Vilisi is an FDA-approved treatment specifically designed to address low libido in women. As an on-demand medication, you use it only when you actually want it, providing more autonomy than a pill required every single morning. This guide covers 3 stages: mastering the physical injection, optimizing your timing, and navigating physical side effects. It is common to feel a sense of anxiety regarding the injection itself, especially if you have a phobia of needles. The medication uses an autoinjector, where the needle remains entirely obscured by the enclosed housing, making the device look much like a standard medical pen. Removing the visual trigger of the needle helps stop the body's stress response, ensuring you can administer the dose calmly and accurately. To begin, wash your hands, gather your prescribed pen, and find a comfortable seated environment. Pull the protective plastic cap straight off the end of the device. Before proceeding, you must perform a safety check by locating the indicator window on the side of the pen. This window must be entirely transparent. Clear glass indicates the device is properly loaded and ready for use. Vilisi is delivered via a subcutaneous injection. This means the medication targets the fatty tissue rather than reaching the muscle or veins. The most effective site for a subcutaneous injection is the soft tissue of the abdomen. Use your fingers to gently pinch a localized belly roll to isolate the injection site. Pinched tissue ensures the medication is absorbed at the correct biological rate, avoiding the pain associated with an accidental intramuscular injection. Press the operational end of the pen firmly into the center of the pinched skin. You will feel the initial snap of the needle, which typically results in a minimal, fleeting prick. It is important to maintain steady downward pressure against the skin, resisting the natural reflex to pull the device away prematurely. Keep the pen in place and listen for the definitive audio cue of a second click, which signifies the dose is complete. Pull the device away only after that second click, then immediately check the indicator window. The previously clear window should now be a solid purple. This color change is your visual confirmation that the full dose was delivered. Replace the protective cap and safely discard the single-use device. The combination of the audible click and the visual color change removes human guesswork, guaranteeing the medication was administered correctly. With the injection finished, you can focus on the strategic timing needed for peak efficacy. Official guidelines suggest administering the dose 45 minutes before intimacy. For an optimized experience, consider expanding that window to a full 1 to 2 hours beforehand. Since the medication remains effective for up to 24 hours, an earlier injection allows for a more flexible schedule. Administering the dose early provides the body the necessary runway to transition into an aroused state without the pressure of a ticking clock. Utilizing this timing buffer shifts the experience away from a rushed scenario into a state of relaxed anticipation. Physical side effects serve as a concrete signal that the medication's active compounds are beginning to operate in your system. You will likely experience a hot flash shortly after injection. This peaks quickly and subsides over the following 45 to 60 minutes. 40% of users experience nausea, mostly during the first use. This probability drops significantly with subsequent doses as the body acclimates. Keeping an over-the-counter anti-nausea medication accessible provides a practical safeguard during your first few sessions. By mastering the timing, confirming your dose, and knowing what to expect, you have removed the variables of anxiety. Your body is now fully prepared to respond when the moment is right.